around since 1970. We were the company that introduced smoke detectors in the US in 1970. Then we went into air filtration and water filtration. And then in 1993, with a divine connection between Dr. Smokey Centillo and the Juice Plus crew, Juice Plus was born and was put onto the market. So what Juice Plus is, very simply, is whole food, real food that has been encapsulated, crushed into a powder, put into capsules, put into soft chews as well. But I'm not going to spend too much time on the Juice Plus product because my buddy, Coach Carla, the transformation coach, is going to share some information tonight. And it's not too late. You can still text a friend and invite them in to this call or tell them to go on to YouTube and check it out. Carla, the floor is yours.
Thank you so much. Um, I'm really excited to be here with you guys today. I'm Coach Carla Joy. Thank you, Ruth Presley, for, as always, for being such a wonderful hostess. We've been doing this for quite a while, and we just really enjoy sharing time with you. Those of us who are on the call live, I want to thank you for being here. And I want to just remind you of the fact that there's some hard truth, but there's hope about breast cancer. But before we dive into that tonight, I wanted to let you know what I am doing here. Why am I here? Well, some years ago, a couple decades ago, I found out that I had high blood pressure, high cholesterol, and prediabetes. I don't know what that means for you, but for me, it was life changing. I felt scared. I felt that my whole world was shaken. And I don't know if that's ever happened to you in a situation, but it prompted me to grab one of my best buddies and start going on a journey towards finding some answers. During that journey, we tried several different things. We went to different places, we read different books, and we tried different methodologies. But one day, my goddaughter introduced me to the documentary Forks Over Knives. And also, she introduced me to the lecture by Dr. Michael Greger, which talks about uprooting the causes of disease. He specifically went through each of the 15 most common causes of death listed by the CDC and showed the research that indicated that making changes in lifestyle, but specifically nutrition, could make a difference. I'm telling you this story because I made changes based on those two pieces of information, and a year after adding concentrated fruits and vegetables to my eating plan, my doctor gave me a clean bill of health. And I'm sharing this with you because I want you to have the hope that suddenly arose within me. And even though today's session is called The Hard Truth, it's also called Hope about breast cancer. So, the information that I'm sharing with you this evening is based on some presentations by Dr. Christy Funk. She is a published author. Her book, Breast, the Owner's Manual, and she is a cancer breast surgeon. So she was speaking on the exam room, and so you can find the lecture there, where she was talking about the state of cancer in the United States. She said that based on the treatments that we have developed in the United States over the past few decades, we have better survival rates for cancer, better treatments. However, the incidence of cancer is actually increasing. And the incidence is increasing in younger and younger women, so that there's a yearly increase in the number of women getting diagnosed with breast cancer, especially under the age of 50. So, um, what can we do? I mean, First, let's take a look at what is breast cancer. During her presentation, she explained that breast tissue looks like, could be thought of like grapes, and the lobules would be the grapes, and the stems would be the ducts. So you may have heard of ductal cancer and lobular cancer. So she was sharing that 75% of cancers start in the ducts. So if you were looking at some grapes, the lobules would be the grapes and the ducts, the stems would be the ducts, and that 15% of breast cancers start in the lobules, and there's a 10% that starts somewhere else. She also went on to explain that if you were to take one of those stems and then cut them in half, you'd end up with a little a, a circle of one cell where the cells of the duct are. And one of the first stages of change would be something called hyperplasia. Another stage would be atypical ductal hyperplasia. And the third stage would be ductal carcinoma in situ. Now, you may have heard about that designation. And she was saying that most of those situations where a woman is diagnosed with ductal carcinoma in situ, they don't go on to develop cancer. But some of them do. About one third can. And if they do, they develop into ductal carcinoma in situ with microinversion. You may also have heard of um, uh, ductal carcinoma stage 0. That would be the ductal carcinoma in situ. With that's the classification that they give it. So the persons who have ductal carcinoma in situ, she said they would probably never need chemotherapy for that situation. But for those cases where there is micro invasion, that's where the cells have actually broken through the wall and it's just a small amount of invasion. And then the last stage she talked about was invasive ductal cancer. So she explained that there are other ways of describing the cancers, and it depends on the receptors on the cell. So think of a cell uh, as a sphere. They're not all shaped that way, but think of it that way. And they're sticking out on the surface are receptors, so that when things go by, they can attach to it and trigger changes in the cell. And she said that there are subtypes that have receptors. Estrogen receptors, these tend to be less aggressive. Progesterone receptors, there is no prescription or food that impacts the progesterone receptors. And then there's HER2, which is a growth factor. So if a cancer is HER2 positive, then it is more aggressive, and that could be 15 to 20% of the cancer. Now, there are modern treatments. It's usually surgery, radiation, chemotherapy, um, anti-estrogen therapy, biologic targeted therapy, immunotherapy, diet, and lifestyle. When it comes to surgery, now Dr. Fink is a surgeon, so she did talk about what's involved in surgery. She said that there are two main kinds of surgery: lumpectomy and mastectomy. But under lumpectomy, you can have lumpectomy, a removal of the cancer with margins, lumpectomy alone, or lumpectomy with radiation. She said that there was a study in the 1980s, and in that study, when they looked at the survival, they found that women who had lumpectomy alone, lumpectomy with radiation, or mastectomy, they had the same survival rate. The survival was identical. Now, the differences would be with respect to local reoccurrence. So when if you know a person who is dealing with cancer, one of the questions that they'd need to ask their doctor is about the risk for local reoccurrence and the risk for distant reoccurrence. So they found that nowadays, lumpectomy plus radiation, again, they had identical survival, but um, when they added an anti-estrogen drug to the protocol, it reduced the risk of recurrence from about 4 to 6% to about 2 to 3%. And the other thing she said that needed to be considered if they were thinking about surgery is whether there were gene mutations in the cells, the cancer cells themselves. If the gene mutation for BRCA, this is in a person who has already had been diagnosed with cancer, then there's a 65% chance of a new cancer in their lifetimes. If the tumor itself is large and the breast tissue is small, then she would recommend the use of radiation or chemotherapy. And there are cases where women either find getting access to radiation too difficult or they choose not to have radiation. Then there are certain exceptions where if the tumor is larger than 5 centimeters, if it's invasive with positive margins, if there are also lymph nodes, 4 or more lymph nodes that are testing positive for cancer, and if there are HER2 positive, if they have that HER2 positive, then that is more aggressive. So the other treatment is radiation. And I'm sharing this information just for your education. I want you to remember that the information that we share here is not to be used instead of a consultation with your physician. I just want you to have the wisdom of this information so that you can ask informed questions. They found that radiation, as I said before, radiation, there was no recurrence. If there was no radiation, there was no recurrence, about 40% over 10 years. If there was radiation, the risk was about 4 to 6% over 10 years. But there are side effects to radiation. If the radiation was given, then the lungs or the heart tissue could be damaged. If the person already had a history of radiation, there could be risk of now radiating again and increasing the risk of causing cancer because of the second dose of radiation. If the woman already had implants, then exposure to radiation could result in something called contracture. The tissue around the implant could harden, and she said it looked like coconut husks in the breast. And there's also a difference between radiation that is done out from outside of the body and radiation that can be done during the surgery called intraoperative radiation, where it's just exposing the tissue around the removed the removed cancer, and that's only that tissue is exposed to the radiation. So again, hopefully this information will give you something that you can discuss with your physician. Finally, there's chemotherapy. And chemotherapy is usually recommended for estrogen positive, um, HER2 negative. There is less than or 4 lymph nodes. And if there is a low risk of multiplication, if if the there's a specific set of tests can be done that can show the risk of recurrence, and if that is low, then chemotherapy would be recommended. So she's saying that 65% of cancers, there's no need for chemotherapy, and that the others fall into about 35%. So, um, what is the benefit? So, with chemotherapy, you have chemicals that are floating around in the blood, and there is a potential risk of recurrence if you don't have that chemotherapy. And those are the numbers that you want to ask your doctor about, and get a clear understanding. So, for example, if the doctor is saying that you have a 10% risk of recurrence without the chemotherapy, and you have a 12% risk of recurrence with the chemotherapy, you have to talk to the doctor about what's the difference in that risk and what are the side effects. Because the side effects can be bone loss, fatigue, nausea, vomiting, loss of hear, and other side effects that you'd want to know about when you're trying to make a decision. Um, one of the one of the questions that comes up was, what about diet and lifestyle? Well, that's huge, because that's one of the things that Dr. Funk said actually is used to lower the risk of actually getting cancer. But she said that there are some situations where people are told not to have oxidants not to have antioxidants during their treatment. And she was explaining that it's not that you cannot have antioxidant foods like fruits and vegetables. We know that those are antioxidants. And the chemotherapy is an oxidant therapy. So they would, in my mind, contradict each other. But her explanation was, you would not use high doses of an oxidant. So she mentioned something like turmeric. You wouldn't take 6, 10, 12 teaspoons of turmeric during chemotherapy, because that would have a counteraction effect on the chemotherapy. But if you were making a smoothie as part of your regular meal and you wanted to sprinkle in a teaspoon of turmeric, that would be okay. Again, these are discussions that you want to have with your physician so that everybody's on the same page. And what she's talking about is super isolated, concentrated, a single oxidants. You don't want to use those during the period of your chemotherapy, because it will be counteractive. Right? So I hope that that is helpful. And then she went on and to talk about what we can do. We're all about looking at, all right, we know that breast cancer exists. We know that instead of having found a cure, we don't have a cure, she said, and that the incidence is actually increasing. So, what can we do? The idea is that we need to improve our control of the risk. How about we avoid getting breast cancer in the first place. So she talked about the fact that there are lifestyle changes that we can make that will improve, reduce our risk for developing breast cancer. She spoke specifically about fruits and vegetables. And then she gave a list of the top fruits and vegetables that would help us in our lowering our risk. She talked about cruciferous vegetables, things like broccoli, kale, cauliflower, and arugula, those kinds of vegetables. She also spoke about soy. And I know that there's often a debate about whether soy is good or bad. But here is the breast cancer doctor saying that soy is actually protective. She explained in another place that soy has compounds that block estrogen receptors on cancer cells so that estrogen can't trigger the growth of the cells. Then she spoke about berries. She said that berries were very high on the list of reducing the risk for breast cancer. She also mentioned flaxseed, but said that we had to grind them before we eat them so that they don't pass through our body, through our digestive system. So flaxseed should be added to our eating plan, but they should be ground before being eaten. And then she mentioned green tea. There was actually research done on cancer patients, and they found that taking 3 cups of green tea a day reduced recurrence for women who had stage 1 cancer and stage 2 cancer. So she really encourages us, based on the research, to increase the amount of green tea that we have. But she said, don't put things like milk and sugar in your green tea. I don't know if she meant no sugar at all, but no dairy products in your green tea. And that brings up, well, what is it about dairy? So even though dairy products have elevated amounts of calcium, vitamin D, butyrate, conjugated isoflavones, these are additives. And we have to balance the fact that that dairy products come from animals that have 10 times more estrogen because they're pregnant than normal. And that estrogen gets into the milk. And milk also contains saturated fat, and the estrogen travels with the saturated fat. In addition, milk triggers an increase in a hormone, IGF-1, insulin-like growth factor 1. And we already have enough of that. We don't need any more. So milk also may have pesticides, herbicides, residues of different chemicals, antibiotics, and even aflatoxin has been found. So she recommended that because dairy was high fat, that we should avoid all dairy products, and that includes cheese, butter, yogurt, and cream. Research showed that when they looked at people who had more than 1 serving of high fat dairy versus those who had less than half a serving, there was a 49% increase in all-cause mortality in those that had 1 serving of dairy products a day. And she also mentioned that butter, margarine, or lard also had an increase in breast cancer mortality. The question of coconut also came up, and remember, coconut has saturated fat, and so you want to reduce the amount of that I'm not saying eliminate it, but you don't want to use it in excess. Finally, she spoke about meat as a something that you would be concerned about to reduce the risk. She said that you should remove all processed meat. Now, don't shoot the messenger. I'm trying to give you this information so that you can make informed decisions. So sausages, bacons, and even sliced turkey breasts would be considered processed meat. And it's the nitrates in these processed meats that is usually considered the culprit. They found that women who used processed meats had a 25% increase in breast cancer. And the women who were involved in this study, a lot of them were African American. Now, what about red meat? We already know that red meat is implicated. It's high in cholesterol, high in saturated fat. It triggers insulin like growth factor 1. It has hormones in it. And when we cook it, it produces heterocyclic amines and polycyclic aromatic hydrocarbons. These are cancer causing agents. But there was the idea that if we gave up red meat, then we could just eat chicken. And she said that when you cook chicken at 350 degrees, you get the same sort of toxic compounds being produced. Now, you're saying, well, everybody eats chickens and not everybody has breast cancer. So again, it's about the amount. So try to minimize your exposure to animal products. According to the studies by T. Colin Campbell in his book, The China Study, he came up with a formula that less than 10% of your calories coming from animal products kept you in the safe zone. So again, it's about the amount. And one final note, what's in chicken? Have you ever seen a contents label of content ingredients on a chicken label? Well, some researchers were wondering what's in the chickens. And so they decided maybe what's in the chicken would get stored in the feathers. So let's test the feathers and see what's there. They found traces of antibiotics, arsenic, Tylenol, maybe the chickens had headaches, antidepressants, caffeine, maybe to wake them up, I don't know, antifungals, antihistamines. And so all of these things were in the feathers. And you might think, well, the feathers, that got stored in the feathers. Maybe it's not in the chicken. Well, it turns out that very often these feathers are chopped up, crushed, and fed back to the chicken. So even if it wasn't in the chicken, now they're eating meal with the feathers included. That is not good. So I hope that you can make some decisions based on the information we've shared today. But to help you go one step further, I mean, for some of us, this information was a bit shocking. To help you go one step further, we at the Juice Plus Company have come here to share with you some things that you can do. You can be proactive. You can actually start adding concentrated fruits, vegetables, and berries to your eating plan. We have our traditional capsules, which contain 10 fruit, 10 vegetables, 10 berries, and the omegas, which contain omega oils 3, 6, 3, 5, 6, 7, and 9, not obtained from fish because fish don't even make omegas. They get it from the algae. So the algae and 5 other plant sources. And we don't just take out omega 3, we provide the range of omegas as they occur in nature. So you can have the capsules. And you can also have the chewables. They were originally developed for children, but a lot of us adults like them and find them easier to take along with us. In addition, the Juice Plus Company now has the superfoods. You can simply add the contents of your two fruit, vegetable, and berry capsules, they're all here, and you just add it to about 8 ounces of water. That gives you your serving of fruits and vegetables. And a lot of us need to drink more water, and a lot of us would like a little pick me up in terms of getting a little more energy, a little more focus, but we don't want to be zinging all over the place. And so the Juice Plus company has introduced Luminate. Luminate contains coffee berry, mushrooms, ashwagandha, and a couple other ingredients. You can ask the person who invited you. And we're talking about these today because we know that everybody wants to preserve their health. And for us who are women, we want to do something, we want to take action so that we can reduce our risk, or if we've already had an encounter with cancer, breast cancer, another type of cancer, we want to give our bodies the best support so that we can be healthy and even in the face of an old diagnosis of cancer. And the Juice Plus company is here to support you as you give your body what it needs to heal itself. We know that we need fruits and vegetables and grains. All doctors will agree that we need to eat more. And the CDC and the American College of uh, uh, the American Association for Diabetes, for cancer, for heart disease, all of these associations agree that we need to eat more fruits and vegetables. So when you start on this journey, you're helping yourself by reducing your risk of cancer. You're also helping yourself by making your body healthier so that you can reduce your risk for all cause mortality and for some of these other conditions. I hope that the information you heard today was encouraging. I know it's sad to know that we don't have a cure for breast cancer, even with all the work that has been done so far. But we do know a little bit more about the treatments. We know a little bit more about what we can do, and we know a little bit more about how we could get started. Adding fruits, vegetables to our eating plan. Talk to the person who invited you. And as we close out this evening, we're going to unmute ourselves and say what we say every Friday night when we get together.
Eat
Eat more
More
fruits
fruits
and
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 vegetables.
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 There you go. Eat more fruits and vegetables. This is Coach Carla Joy saying, eat more fruits and vegetables. Join us next time and let us know